Friday Night Live with Cat Carter. Get ready, set, let's go. Come on. It's Friday night. It's Friday Night Live. It's Friday night. It's Friday night with Cat Carter. It's Friday night. Hey. It's Friday night. It's Friday night. Yeah. It's Friday night with Cat Carter. It's Friday night. It's Friday Night Live. It's Friday night. It's Friday night with Cat Carter.
Hey, welcome to Friday Night Live. I am your host, Cat Carter, and I am so excited to be here because I'm surprised I haven't melted. It is 100 plus degrees where I am with a heat index of 110, and we still do not have our AC running because the tree fell on it.
And the insurance is taking their sweet time.
But got some good news. Got some good news. They're going to put us in a hotel this weekend. Praise the Lord, because it is hot, 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 hot. Can you say hot? Yes, it is very hot. So, Friday Night Live is a positive platform where we come to inform, innovate, and inspire. And one of my favorite artists, doctors, is here tonight. He is no stranger to FNL. Dr. Ronald Rembert Jr. is in the house, y'all, and he is going to be our guest doctor tonight. We're going to be talking about men's health, which is so befitting because I almost said all men, but that's not true. Some men don't like to go to the doctor. And so we're going to be talking about some issues such as with the prostate, testicular cancer, infertility, erectile dysfunction. I'm sure he's got quite a few things to be talking about. We're going to be talking about what it is, symptoms, and what it can do, and maybe what you need to do to get some help. So without further ado, I'm going to bring up Dr. Ronald Rembert Jr.
Hey, Kat, how are you?
Yes, sir. How you doing, Dr. Rembert?
Doing good. How about yourself?
Hot, but I am doing good. I am so excited to have you back here. I mean, every time you come, we either getting some rich information or we're hearing you tear up that saxophone, which y'all, I'm going to pull his leg. I got a couple of videos. We'll probably play some of those a little bit later. So what we're going to be talking about, Dr. Rembert, tell us all about it.
So, as you mentioned, many times men don't like going to the doctor. And I know at one point I was like that as well. I was more concerned about taking care of other stuff than taking care of myself. But the thing that I had to realize, if I'm going to take care of others, I have to be able to take care of myself as well. So, as I talk about men's health, I'm talking about, some of the common things that men have had to deal with in terms of aging and health, but also just things that men don't typically want to discuss. You mentioned erectile dysfunction, testicular cancer, prostate cancer. I've had patients that I've had to treat with all of the above. And many times it's something that we as men don't like to discuss. We sometimes want to keep things to ourselves and don't necessarily want to share.
I
But
was going to
sharing,
ask you, Dr. Rembert, like, why is that? Why don't men? I mean, I guess I don't like going to the doctor either, but it just seems like men, they don't really, they'll, mm-mm.
well, it depends on the man, it depends on the person, but many times we're taught to suck it up, be strong,
Gotta
be
be
a man.
strong and tough. Mm-hmm.
Exactly. And it's like, and that not only goes along with, dealing with pain or dealing with issues where in some cases women are more free in sharing what's going on with them. Men have a tendency to not share as much. So we can be walking around in pain, walking around suffering, walking around having all kinds of symptoms and don't say a word. And hopefully, with this discussion this evening, we can alleviate some of that.
Yeah, that's what I'm hoping to. Yeah. Okay, well, I'm gonna be quiet and let you get started and hear what you got to say. Of course, I'll probably be asking you something, bugging you later, but I think this is a really important topic that we need to be talking about because I love my men. I mean, my uncles, what I'm saying. We love our men, and so when we want them to be healthy and we want them to be around for a while, and so
Mhm.
because of that, you got to take care of yourself so you can be here for us. So go ahead, Dr. Rembert.
Definitely. And what I'm sharing with everyone is a presentation that I was able to share earlier this year with the group in Chicago. I've also given men's health presentations in other organizations or with other organizations, as well as in some church groups as well. But this is something that's near and dear to my heart. I don't share this a lot with folks, but those who are closer to me, I've shared this with. My father passed away at the age of 32 from a heart attack. He had served in Vietnam, and basically, from what I've been told, he was exposed to Agent Orange as well, which I honestly believe hastened his demise. And that was something, and an impetus for me to look into going into medicine and look at ways of, making sure that other people didn't have to go through what me and my family went through. So, with that being said, I'll go ahead and get started. This is just a brief bio. Um, just stating I'm a family physician. I'm a part of the Family Health Foundation of Illinois, a fellow of the American Academy of Physicians, and a member of the National Medical Association. And I'm working as a consultant with different healthcare entities around the United States. Now, before we start, I got to give this medical disclaimer. All the content and information shared during this presentation is for informational and educational purposes only and does not constitute medical advice nor establish any type of clinician-patient relationship by attending this session. Now, I strive to provide accurate general information. The information presented here is not a substitute for any kind of professional medical advice, and you should not rely solely on this information. Always consult a medical provider in the areas for your needs and circumstances prior to making any professional, legal, medical, and or financial decisions. And do not delay seeking medical treatment because of something that you've heard, read, or viewed in this presentation. The presenters are not responsible nor liable for any advice, course of treatment, diagnosis, or any outcomes for anyone who watched, listened to, or participated in this presentation. So this evening, we'll be talking about overall health, looking at chronic diseases, some topics, as I mentioned, including erectile dysfunction, testicular and prostate cancer, and then just looking at ways that we can manage our health. And then if we have some time, I open it up for some questions as well. So starting off with this slide, and this slide kind of puts stuff in perspective. This is a slide that I got some information from the Centers for Disease Control. They collect data on deaths, causes of death, illness, and help to not only keep track of these things, but also work with various hospitals, healthcare entities across the United States to not only gather information, but to educate and inform the physicians, researchers, as well as the general public. And as we can see just on this slide, heart disease, cancer, stroke, cardiovascular diseases are by far one of the leading causes of death that we see in our country. This was from 2021 when we were in the midst of the COVID pandemic, and you could see the number of deaths that were COVID-19 related, but also the number of accidents that we also seen as well. So this is not an exhaustive list, but it just lists some of the leading causes of death, and this is for the year 2021. So let me get into it. So what is health? Health is our overall state of well-being, both physically and mentally, but also spiritually. This entails many things, including getting sufficient rest, nutrition, exercise, mental and emotional stimulation, as well as preventing and treating disease and illness. So how do we have and maintain good health? Well, as I mentioned, it's not just getting rest, nutrition, exercise, but it's mental, it's emotional, it's spiritual as well. And all of those things play a role in our overall health. And in here, I included, some statistics about life expectancy and how typically in our country, women tend to live longer than men. The life expectancy actually decreased in 2021 versus 2020 But as I mentioned, this was during the COVID-19 pandemic as well. But according to the statistics from the CDC, women tend to live 5 or more years longer than men in this country. So let's look at chronic diseases. These are diseases that are defined as conditions that last a year or more, require ongoing medical attention, and may limit daily activities. And 6 out of 10 adults in the United States have at least one chronic disease. 4 out of 10 have 2 or more. And the overall cost for treating these chronic conditions is over $4 trillion. Not billion, not million, trillion. And I have a link that shows just the expenditures on chronic diseases that we see in this country. So I mentioned some of the chronic diseases that we deal with, including heart disease, diabetes, and how these diseases disproportionately affect people of color, including Black and Latino people. Heart disease, cancer, diabetes, and stroke are some of the most common causes of illness, disability, and death affecting a growing number of Americans. And if they're diagnosed later on in life, left untreated, those individuals tend to have worse outcomes, including for diabetes, you can have loss of nerve function, kidney function, loss of eyesight. Sometimes you can have injury that can sometimes lead to amputations of the toes, feet, and legs. And heart disease and stroke, you can have blockages of the blood vessels that can lead to serious conditions like paralysis or even death. So we've seen these and have dealt with these and treated these for decades and even more than decades. But the thing is, these diseases, we see a disparity in our communities, and we need to work on eliminating not only the disparities, but work on effective ways of treating these things in our communities. Now, we're looking at some of the root causes, including social determinants of health, including poverty, lack of education, discrimination, racism, as well as the stigma associated with treating some of these diseases. We're also looking at the environment and some of the community conditions that lead to some of these, including property neglect, food deserts where there aren't food stores in certain communities that sell fresh and healthy foods. Looking at what people are exposed to, the advertising, the violence in their communities, things that can have an adverse effect on their health, as well as the resources available. And I mentioned like food desert, but transportation can be an issue. Access to healthcare can be an issue. I mentioned medical services and the availability of quality medical services, as well as behavioral factors such as diet, physical activity, tobacco, alcohol, and illicit drug use. All of these play a role in our overall health. Now I'm going to get into some of our topics for this evening, specifically dealing with men's health. First topic is testicular cancer. And we many times see this in males from 15 to 45 years of age. You may have symptoms including a growth or a bump or lump on your testicle, basically within your scrotum. You may also feel this in other parts of your body, but symptoms that we typically see include heaviness or tenderness in the scrotum. You can also have pain in your stomach and groin area. You can have enlargement of the chest tissue or breast tissue that may be associated with some of the hormones related to the growth in the testicle. You can also have back pain. Now, some of the risks include a family history of testicular cancer, a history of having an undescended testicle, as well as we do see this in younger men, ages 18 to 25. Now, we typically recommend you seeing a doctor if you're having symptoms that last 2 or more weeks. And if you're checking yourself on a regular basis and you notice this, please seek out medical attention. Now, prostate cancer. Let's first deal with what the prostate is. It's a small gland that produces fluid to nourish and transport sperm. And in men, this can typically be one of the most common types of cancer that we normally see in men 65 years of age and older. Some of the symptoms associated with this include difficulty urinating, as well as decreased force of your urine. Sometimes you can even have blood in your urine or semen. You can have pain in your bones or joints. You may even have some weight loss without trying, and one of the main symptoms we often see is erectile dysfunction, difficulty getting and maintaining an erection. Now, some of the risk factors include age of more than 50. We see this a lot more in African Americans than we do in other groups. Family history does increase your risk of getting this, as well as obesity. And when to see a doctor about this? If you're having persistent symptoms that are affecting you daily, we recommend you getting checked. And typically, we recommend every man get their prostate checked every year, especially those over the age of 50, those who have a family history of prostate cancer, or if you're having any of those symptoms that I mentioned previously. Now, erectile dysfunction is the inability to get and keep an erection firm enough for sex. And unfortunately, this is relatively common. It can be caused, or one of the effects can come from stress, but it can also affect your self-confidence and lead to more stress. But oftentimes, this is a symptom of something else that's going on. In many cases, there's underlying heart disease, diabetes, or some other cardiovascular disease that's affecting your ability to get and maintain an erection. You may also have reduced desire to have sex. Now, when do you see a doctor about this? If you're having concerns about your erections, if you're having sexual problems such as premature or delayed ejaculation, or if you have heart disease, diabetes, or some other chronic diseases that can be linked to erectile dysfunction, you definitely want to have this discussion with your physician. Now, some of the causes that we've seen, as I mentioned, some of the chronic diseases associated with it that can lead to poor blood flow, nerve damage, hormonal issues like low testosterone, psychological and emotional issues like stress and depression can also have an effect, as well as certain medications, drugs, and alcohol, as well as tobacco use. All of these things can contribute to having erectile dysfunction. So, as I mentioned, these are some of the things that can lead to erectile dysfunction or may have a role in causing it. And we want to look at all of these things when we're checking to see why you're having erectile dysfunction, because typically it's a symptom of some other ailment, disease, or dysfunction that's occurring in your body. Now, we'll talk briefly about men and our fertility. Now, typically when men have sex and they climax, they can release greater than 15 million sperm in just a small amount of semen. And in that sperm, for it to be considered healthy and viable, basically that would have the potential of impregnating their partner, there should be at least 40% of the sperm that's able to move. Now, there are certain medical issues that can affect men's fertility, including testicular disease, age, as well as some of the pituitary and hypothalamic issues. The pituitary and hypothalamus are glands in the brain that produce hormones that affect not only the way we make sperm, but even the way our body functions on a regular basis. So if you're having issues with fertility, say that you and your partner are trying to have a child and there's been some issue there, you may need you and your partner to be checked. But typically there's tests that we can do that can determine whether or not your sperm is viable, whether it's healthy and able to reproduce. So there are certain tests that we can do, but we typically have to get a good history and find out some of the other things that are going on as well as testing your partner as well. So some of the steps that we can use to increase healthy sperm: maintaining a healthy weight, eating a healthy diet, testing and preventing sexually transmitted diseases. Diseases like chlamydia and gonorrhea can cause infertility. You also want to manage your stress, as well as increase in exercise and regular movement. Moderate physical activity can also help to increase your healthy sperm. In some cases, you may want to avoid tobacco, alcohol. Sometimes you may want to avoid certain lubricants when using these during intercourse. You also may need to check which medications you're taking because certain medications can have an effect on your sperm count, as well as avoiding certain toxins, including pesticides if you're working with certain chemicals, and using protective equipment to protect yourself from coming into contact with certain chemicals that can affect your sperm count, as well as even the way that you wear your clothing. Loose fitting underwear can help to increase your sperm count, as well as avoiding saunas and hot tubs. Now, if you're attempting to have a child with your partner and you've had more than a year of unprotected sex and you're trying actively to have a child, and you're less than 35, or if you're greater than 35 and you've had 6 months of unprotected sex, we ask that you would get checked, and basically, you and your partner would be checked so we can get to the bottom of what the root cause is. Now I'm going to look at some ways that we can manage our health. And this is from the CDC. 4 main ways of decreasing our risks for many chronic diseases. Avoiding alcohol use or tobacco use and exposure can increase your health, as well as decreasing your risk for chronic diseases. Improving your nutrition, increasing your physical activity, as well as I mentioned, decreasing or avoiding alcohol use. I also recommend regular checkups, meditation, and prayer, and pursuing activities, hobbies, and interests that you enjoy and give you a sense of purpose. These things can help promote health and balance in your life. Now, I want to open this time up for questions, if there's any questions, and we can kind of go from there.
Okay. Excuse me. Dr. Rembert, I wanted to take a quick break right quick while they're working on their questions.
Okay.
And I'm going to play circles. So tell us a little bit about this video that I'm getting ready to play.
Awesome. This is me playing a song that I wrote called Circles. Put it out as a single a few years ago. And this is just me doing a version of it while I was in the studio. So enjoy.
Okay.
Circles. And we go in circles, trying to figure out where I am today. The sky was so purple, and the wind was blowing every single way. Looked like a storm for me. As I looked up into the sky, soon it will storm me. Each cloud trying to cry, I'm looking for shelter. I need shelter from the rain. Life's so helter-skelter. Life had me filled with so much pain. Sick of the circles, tired of going round and round, moving just like a turtle. Now it's time for me to get up off the ground, still spinning around like a top moving on the floor. I keep hitting the ground while I'm looking for an open door. Can somebody help me? Or will you just watch me and stare? Can somebody tell me which way to be free and how to get there? Time cycles of the circles. It's time to be free. came all the hurdles, became all the hurdles. Now it's time for me to wear my crown, 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 crown. Thank you, Lord, for my crown, 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 crown. Thank you, Lord, for my crown. Yeah, yeah. Thank you, Lord, for my crown. Yeah. Thank you, Lord, for my crown. Thank you, Lord, for my crown. Yeah. Thank you, Lord, for my crown.
Crown, 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 crown. Oh, thank you, Lord, for. I love it. Crown, crown. Oh, let's get back to it. Okay. All right. I want to send a shout out to Dr. Battle. She was
Yes,
here a couple weeks
indeed.
ago talking about
Awesome.
caregiving, and she's hanging out with
Awesome.
us on the chat. All right. So this is our time to ask questions. Dr. Rembert, thank you so much for giving us such informative information about men's health. We need to know it. I know we don't want to talk about it, but these are things that needs to be talked about. And
Mhm.
the problem with public health and social media is sometimes we don't get the correct information out. And so this is why this is very dear to me as well, because we're giving out the right information. So this is a time to start asking questions, or if you have any comments. I think Marilyn had a question. Okay. Um, what are your thoughts on men getting brachial therapy surgery for prostate cancer?
Well, I think it's helpful in certain cases, but it just depends on not only the staging of the cancer, but also you have to look at, you know, potential risks associated with it. Now, if they're getting brachytherapy, you're concerned about, and correct me, well, I'll say this. Brachytherapy can be very effective, but at the same time, as long as the prostate cancer hasn't spread beyond the prostate, it can be very effective. But at the same time, if the prostate cancer has spread beyond the prostate, you may also need to look at other forms of treatment as well.
Okay. I have a comment. I thought that it was interesting. I believe that the first thing we talked about was testicular cancer. Even though it can affect everybody, it was more prevalent in Caucasian. And then when we got to prostate, even though it was prevalent with it was more prevalent with Africa. I thought that was just interesting, like the different cancers, how it was more prevalent with the different ethnicities. That was
Mhm.
interesting to me. But then when we got to erectile dysfunction, I didn't really see where it was, unless I missed it. I didn't really see where it was like prevalent in just one group, like
No,
anybody. So that was just interesting to me how different cancers are. I don't want to say like, right, but it's just interesting.
we
Like
see it in other part, or
yeah,
see it,
I mean,
it, it varies, but erectile function is something that we see across the board, but it's multifactorial. It's not just from a certain disease, but typically, like I mentioned, it can be from some underlying disorders as well. So if you have something that's affecting not only your circulation, whether it's diabetes, high blood pressure, or other chronic illnesses, but stress can also play a role in it as well.
yeah.
So I mean, it's different things that can lead to it as well.
Okay. Marilyn says, "Thank you for answering her question."
Definitely.
Are there any other comments or questions? I know Brian Barzy said he gets his checkup every year for
Awesome.
prostate.
Awesome.
Yeah. Okay. Here's one. Ooh. What are your thoughts on diverted cyclitis.
Diverticulitis.
Thank you.
Hmm. Hmm.
I was diagnosed in 2021. I had diverticulitis. I had a colon
Hmm.
coloscopy and
Hmm.
an endoscopy. This March of 2023, everything was normal.
Okay. Diverticulitis is typically an acute inflammation within the colon, and in many cases, it can be serious. In some of the most severe cases, you may need antibiotics and/or surgical intervention. But usually it's limited. Once you treat it, person gets better. Now, diverticulitis differs from diverticulosis. And diverticulosis is a chronic condition where you can have outpouching of part of the colon. And in doing so, typically you may not even have any symptoms, but you may need to watch what you eat to make sure that certain foods aren't getting trapped in those outpouches or small pockets that can develop in the colon. Now, if you have acute inflammation of those pockets in the colon, that diverticulosis can sometimes become diverticulitis, which can sometimes be in an emergency. And as you mentioned, you had a colonoscopy and endoscopy. This was after the diverticulitis had been treated, and you didn't have any symptoms, basically had unremarkable tests. The colonoscopy is a test where we use a rubber tube with a camera attached to it to take pictures and visualize within the colon. The endoscopy is typically the same type of tube, typically a little bit smaller, that we put into the throat to go down into the tube that leads to the stomach called the esophagus. We put it into the stomach, and then usually that first part of the small intestine, the duodenum.
Thanks for that question, Brian. Okay. Any other comments or questions for Dr. Rembert? Anybody can ask, even if you're female. I mean, I know we have significant others, and so you may have concerns or whatever. You're more than
Mhm.
welcome to ask questions. Brian says, thank you, Dr. Rembert.
You're welcome. Yeah. Also, and I wanted to add to the question about the brachytherapy, because they're using radiation within the prostate, you do have to check and make sure that, once they're treated, you have to give instructions not only to the patient but to their family about, potential exposure to radiation, depending on, how much of the brachytherapy needs to be used to treat the prostate cancer.
Can any of these symptoms or diseases that we talked about, these cancers, can they be reversed? I mean, I
Mhm.
know after you get past a
They,
certain stage, you probably can't, but
they can be treated. Yes, they can definitely be treated. But as you mentioned, it's treating them in an early enough stage before they metastasize or spread to other parts of the body.
okay. So when should men start getting tested? Like at what age should they start? I know the prostate. Do they test like for testicular cancer and like they do prostate at a certain age?
Not regularly, no. Typically, we're asking men and young men to check themselves. When you're in the
Okay.
shower, check yourself to see if there's a lump or growth, a painful area. Are you having pain in your groin, pain in your back, pain in your stomach? And if you're having those symptoms and you check and you feel a lump or an area of growth, you definitely have to make an appointment to see your physician so that or clinician so that you can be evaluated and we can determine what the cause of it is. So, as for prostate cancer, I know that um, we were recommending screening uh, age 40, but if you have a family history, and also because we're seeing, or I wouldn't say age 40, I'd say age 50, because typically we see it in older individuals, but
Mhm.
we're recommending screening at earlier ages in those who have family history, who may have symptoms, like I mentioned, difficulty urinating, blood in the urine, um, may have other causes or symptoms related to possible prostate cancer that we would want to evaluate at an earlier age and an earlier time.
Okay. So the stamp keeper is in the house. She'll be on the show soon. I think next month. Her question is, so family members can be harmed by the radiation?
Possible, not typically something that we see, but there's a concern that's there, especially just after the brachytherapy treatment has been started, because once they put those small seeds or pellets into the prostate, once they use that treatment in the prostate, there is radiation that's there, and we typically give instructions to the family about radiation exposure, not having people sitting on your lap for a period of time, things like that. So there is a risk, but it's not a great risk, but at the same time, it's something we do have to take into consideration.
Okay.
So there is a YouTube creator that I've been watching for a little bit. That does goes to like haunted houses and like tries to debunk them and stuff. And he was diagnosed with testicular cancer. He was like in his late 20s. And he went through a process called cold capping because he was very insecure about losing his hair. And it's kind of like a not really pseudoscience, but not really heard of, and only specially certified or trained people can actually do it because it's so dangerous because you're using dry ice.
Are you familiar with that kind of therapy, Dr. Rembert?
No, you said cold capping?
Yeah.
Cold capping, yes.
So in the video, it was like this very big compression Velcro cap that would sit in a cooler with dry ice, from what I understand. And the person that they had trained to help him with it would put a new cap so his head would be cold for at least like 18 hours out of the day to help preserve the hair follicles so they didn't fall out during his chemotherapy.
Okay. Wow. I've never heard of that.
I've never heard of it either.
Yeah.
Wow.
That's new.
Yeah. And as you mentioned, chemotherapy, because it treats fast growing cells, it's effective in treating certain cancer cells that are rapidly growing, but it can also affect rapidly growing cells like hair follicles, like hair cells. So that's when we see damage to the hair follicles and people beginning to lose their hair as well.
I when I was working on my master's, I did salivary gland cancer, and just talking about cancer, it seemed like you could do surgery, but it seemed like radiation and chemotherapy was the way to go as far as trying to eradicate cancers.
Mhm.
That, at least in my studies, that's what I saw.
Is radiation therapy the only way, really?
So she's asking, is radiation therapy the only way? I know, like sometimes they'll try to do surgeries,
Mhm.
chemotherapy,
Surgeries,
radiation.
chemotherapy, radiation. But now there's certain gene therapies that are being developed that specifically target some of the genes in cancer cells so that you can treat cancers in certain cases without destroying some of the healthy tissue surrounding those cancer cells. Because with radiation treatment, there's the risk of you're using radiation to basically destroy those cancer cells, but in many cases, the healthy cells around the cancer cells can be affected as well. And we become more and more targeted with radiation therapy, but at the same time, there is that risk. Chemotherapy, as I mentioned, can also affect rapidly growing cells, and we do see the side effects of it with people losing hair, sometimes having GI effects where they're having nausea, vomiting, because it can affect the cells in the GI tract, as well as rapidly growing cells in other parts of the body as well.
Okay. How do you feel about the holistic medicine for cancer?
I think there's a role for it, but I don't think it's the only thing. And you have to take that into consideration. I'll give you an example. I had an uncle, very near and dear to my heart, that I had to see in my office, and who ended up being diagnosed with pancreatic cancer. He was having symptoms at home and told him to come in. I checked him and ended up putting him in the hospital that day. And we diagnosed him with pancreatic cancer. And he had surgery, he had chemotherapy, he had radiation, but part of it was using holistic medicine as well to approach it. There was a nutritionist that worked in the hospital that sat down with our family to have this discussion about, vitamin therapy, making sure that he was getting adequate nutritional therapy, um, making sure that we were working on him being active and engaged so that he wouldn't become depressed. Because sometimes the depression associated with becoming ill can also be a detriment and can increase your risk of an earlier death. So, dealing with some of the emotional and mental health issues related to some of these diseases and approaching it holistically, looking at treating not just that cancer, but treating the person. And also just having a sense of purpose as well. One of the things that I saw that he missed the most was going to work. He worked ever since he was a teenager, and not being able to go to work and not having that self-sufficiency and not being able to get up and do a lot of the things that he used to do was one of the things that I saw that affected him the most. So it's approaching it in that manner, looking at not just chemotherapy, radiation, gene therapy, or other medical treatments, but looking at treating them as a person.
Okay, Dr. Battle says she was talking about the cold capping. She
Awesome.
says it's practiced by some of the oncology offices, Cheryl.
Awesome.
So
Awesome.
she's heard of it a little bit.
Okay.
Are there any other questions or comments? While they're doing that, Dr. Ember, say we have somebody that's listening. Maybe it's a gentleman that's afraid to go to the doctor or to go get checked up, and they may not be necessarily having symptoms, but just or maybe they are. What would you say to that patient or that person or that male?
Well, first, I understand. I know what it's like to deal with illness and not want to be treated, not want to take time out of your schedule, especially if you're busy and you have a lot of things that you're responsible for or doing. But as I mentioned, you have to take care of yourself and other to be able to take care of others. And even more than that, a lot of times we don't necessarily see the value in going to the doctor. Like, what are they going to do? Just give me some pills, or what are they going to do? And it's not just prescribing some medication. It's not just, we're going to give you this regimen that you have to do, or recommend you to see this therapist, or work on it in this manner. It's looking at it like you have someone who's partnering with you for your health, someone that's there to help you to be as healthy as you can be so you can live the best life that you can live. And when I began looking at it that way, it helped a lot. And one of the things that really helps me as well, I've had an opportunity to have some great physicians as my physician. My current physician, his name is Dr. Carl Lambert. He's at Rush. This gentleman and this physician was actually one of the students that I had a chance to mentor as a student in Rush, as well as helping him to, once he finished residency, to come out and come to one of the clinics that I used to work with, because he has done a fantastic job and continues to do a fantastic job. But he genuinely cares about his patients and about the community that he serves. And when you have physicians that are like that, it makes it that much easier to talk to confide in, and to receive treatment from them, because you can trust them. You know that they have your best interests at heart.
Yeah, Dr. Lambert we've had Dr. Lambert on here before. I think when we did when COVID had started, when we did that discussion, got a chance to
Mhm.
meet Dr. Carl Lambert. Yes,
Yes,
okay.
indeed.
Brian says, from what he has read, cutting out the consumption of pork, red meat, and dairy reduces the chances of not getting cancer. Let's see. Dr. Battle says cold
Awesome.
caps scalp cooling systems work by narrowing the blood vessels beneath the skin of the scalp, reducing the amount of chemotherapy that reaches the hair follicles.
Awesome.
And I think she's going to send a link. So if anybody's interested in learning more about that, that's the first I've heard of cold capping too. It's very interesting though.
Yes, indeed.
Yeah.
Yes, indeed.
Yeah.
Wow. Now, to the question that was posed about the pork consumption, dairy consumption, there are certain studies that show that those who have a diet lower in certain meats and animal products can live a healthier life, but it depends on who you ask. And also depends on the studies that you look at as well. There are some people who swear by a vegetarian or vegan diet and have done well in terms of health and longevity in doing so. But I've also seen some people who have done diets that have incorporated meat and dairy and eggs into their diet and also been able to live healthy lives as long as they're eating meats that tend to be lower in fats, fully cooking pork when you're eating it, because the risk of eating or not fully cooked pork, you can have some infections and things that are associated with that as well. So it just depends on the person. I'm not making any recommendation for or against meat and dairy in your diet. What I'm just saying is, for those who choose to eat meat, and I eat meat as well, I try and do leaner cuts and try and do, instead of the dairy, I don't do dairy as much. As well as with the eggs, I tend to do egg whites more so than just a whole egg. Now, I do eat whole eggs occasionally, but egg whites I know are better for you, and I just grown accustomed to eating them at this point.
Okay. Brian says, I'm in that category because my health numbers have been good.
Okay.
Good. That's awesome. Yeah. All right. Any other comments or questions? Okay. Dr. Rembert, do you have? I don't think I have any more questions. Um, I'm gonna. First, I want to. You know what? I'm gonna allow you to give some final thoughts, and I think I'm gonna end the show with "Fill Me Up," your other song that you sent me. But
Okay.
again, yeah, we want to thank you so much, Dr. Rembert. I know Dr. Rembert, y'all. Dr. Rembert is busy. Let me tell you. So I just want to thank you so much for being able to fit me in and come and give us the correct information about men's health. This is some rich information. I have shared it with several public health discussion groups on Facebook as well as men's health. So I'm sure other people are going to be looking at this a little bit as well. Um, Also, you all, there is a survey in the chat. Please take the survey. It's an anonymous survey, and I'm doing a study where I'm looking at the relationship, how strong the relationship is between these type of podcasts, and if you're learning something. So please take the survey. I need the data so I can do the research. Please take the survey. The survey is in the comments. All right. So next week we're going to have another health topic. I've been talking to Dr. Battle, so we're going to see. And once I find out what the topic is, we'll get a flyer out and start advertising. But in the meantime, Dr. Rembert, thank you again. Thank you, thank you, thank you, thank you. So I'm gonna give you a chance to give some final words, and then we're gonna end this show with Dr. Rembert's song "Fill Me Up." Go ahead, Dr. Rembert.
Thanks, Kat, for having me on. Thanks, Cheryl. Appreciate it. Always a pleasure. And just, for everybody listening, like I mentioned, we got to take care of ourselves to be able to take care of everybody else. And me, I've been guilty of it many times where, as Kat mentioned, I can get busy and I'm doing this and working here and doing all of that. And at some point, you have to take time to rest. You have to take time to recuperate and rejuvenate yourself, and just take time to check yourself. You have to definitely incorporate that into your busy schedule. So that there's a saying that says health is wealth.
Mm-hmm.
And I'm learning that even as I get older, because
Me
it's
too.
like when you start having to go, and then you need that time to recuperate and get better and stuff, you start understanding how you've taken your health for granted. So it's like you want to make sure that you're doing the very best you can with what you got. So with that being said, thanks for having me. I appreciate it.
All right. Take care, Dr. Rembert.
Thank you. Thanks, Kat.
All right.